Welcome to an introduction of the Qwik Cardio point-of-care cardiac test for healthcare professionals. Please note that this presentation is meant only as an overview. Chest pain is the second most common reason for emergency room visits in Canada and the U.S. While most of these cases are muscle pains, spasms, or indigestion, patients still need to be monitored in the emergency department to rule out a more serious diagnosis of a myocardial infarction. In fact, only 12 to 15% of all chest pain patients that show up in the ED have had or are having a heart attack. Yet, missed acute myocardial infarction, AMI, accounts for 20% of U.S. emergency medicine litigation dollars. The Qwik Cardio test allows for the faster detection and intervention in those patients having a true myocardial event. The ability to assess these patients in a rapid fashion saves money, reduces ED wait time, and frees up bed space. The Qwik Cardio test is a point-of-care test for two cardiac biomarkers on a single card: troponin I and heart-specific fatty acid binding protein. The test can be used either in a clinical laboratory setting or as a point-of-care test. Inside the Qwik Cardio box are 5 individual tests per box, 1 information for use booklet, and 5 single-use sterile lancets. Bulk packaging is available for hospitals. Qwik Cardio is packaged in a single-use pack. The contents include the test card, buffer solution, and a pipette. A safety lancet is also provided. Given that troponin I, the current biomarker standard, may not be detected in the blood prior to 8 hours after an ischemic event, and that even a 12-lead EKG test may appear as normal in about 25% of heart attack patients, there can be a failure to diagnose an acute myocardial infarction quickly and accurately. Qwik Cardio addresses this problem by combining 2 cardiac biomarkers, troponin I and heart-specific fatty acid binding protein, as an in vitro qualitative diagnostic test. The use of 2 biomarkers increases the diagnostic accuracy for acute myocardial infarction in as little as 20 minutes from the initial onset of chest pain symptoms. A broad diagnostic window is thereby covered with just 1 test. The Qwik Cardio test is a lateral flow immunoassay. It is similar to over-the-counter pregnancy test. The membrane strip contains 2 test lines, one for troponin I and one for heart-specific fatty acid binding protein. Qwik Cardio is not a new product. Qwik Cardio is currently manufactured in Germany, where it has been used in over 1 million instances since 2013. There have been 0 recalls. Qwik Cardio will give the general practitioner, the internist, and cardiologist the freedom to do rapid point-of-care testing in their office or at the bedside, even in the home. Qwik Cardio use in hospitals, including emergency departments, ICU, CCU, PACU, and on hospital crash carts, would allow for a timelier diagnosis of a myocardial infarction and better resource utilization. Other users may include first responders, such as firefighters, EMTs and paramedics, ambulances, airliners, cruise ships and other ongoing vessels, military troops deployed in remote areas, and wilderness or remote population centers.